This podcast is brought to you by North Carolina's electric cooperatives.
This is NC Spin, an unrehearsed discussion on issues of interest to North Carolinians. Now, here is your moderator, Tom Campbell.
Thank you for joining us this week on NC Spin. Without question, the biggest issue of our time is health care, and we want our panel to evaluate where our state stands with Obamacare and with Medicaid expansion. We then focus on the ongoing feud between the State Superintendent of Public Instruction and the State Board of Education and wonder what it's going to take to get it resolved. The panel then looks at the estimated $5 billion it's going to cost to clean up the coal ash at power plants and debates who should pay for that. And as always, we'll ask the panel to tell us something we don't know. Speaking of the panel, joining us this week for the first time, Aisha from the great state of Mecklenburg, first vice chair of the North Carolina Democratic Party. John Hood, syndicated columnist and author. Chris Fitzsimon, political analyst and columnist. And Rick Henderson, the editor-in-chief of the Carolina Journal. Well, we'll begin our uninterrupted debate after these brief messages from our underwriters.
In rural North Carolina, vibrant main streets depend on a thriving agricultural economy. Research at NC State improves the products our farmers raise and grow. NC State Extension brings that research from labs to fields in all 100 counties, which means growth for rural North Carolina. At NC State, what we think and do helps grow local economies. Discover how NC State and Extension work for you. Visit wegrownc.ncsu.edu.
Production underwriting support provided in part by the more than 65,000 members of the North Carolina Retired Governmental Employees Association.
Today's tools make you a real DIYer, and as a member of an electric cooperative, you have lots of valuable tools to help you do it yourself in controlling your home energy use and budget, leaving you free to be Dad.
Let's get to it. Health care, as we said, is the issue for our time, and the question of access to medical care for all is still unanswered. Unable to repeal Obamacare, the Trump administration has seemingly inflicted death by 1,000 cuts. The latest blow was the drastic reduction in navigators to help people get insurance. And despite neighboring Virginia's decision to expand Medicaid rolls by 400,000, our legislature continues to refuse to discuss the issue. Rick Henderson, at the heart of both of these discussions is the question of whether health care is a right or a privilege. What do you say?
Well, there's actually a third option. Is it an entitlement, which is the way that we've treated it over the past 50 plus years? What we have decided is that if you're of certain classifications, if you're over 65, if you are disabled, you qualify for Medicare. And that's a benefit provided primarily by taxpayers, and it was a policy decision that was made. Then for people who are poor or who have other issues, for children and the like, then if you go below the poverty level, it's Medicaid. Again, an entitlement, not a right, and it's something that can be altered by congressional action. North Carolina's decision not to expand Medicaid largely has been a positive one because of experiences in other states. The Urban Institute did a study of the people who would be eligible for Medicaid expansion in North Carolina, somewhere between 400,000 and 500,000 people. And they found out that about 83% of them are childless adults. So these are people who are working and who are not part of the people Medicaid was supposed to help. That is, single mothers who can't work and folks like that. So that's part of it. And the second thing is they found out that about 35 to 40% of the people who would qualify for Medicaid expansion are already buying private insurance now through the Obamacare exchanges. So basically what you're doing is you're taking people who are not on public assistance and putting them on public assistance.
But Aisha, one of the things that is, Rick was elaborating on all of these things, when we've got Medicaid, we've got Medicare, we're pretty much offering, and then we've got government insurance, if you work for an agency of government or the military or what, we're pretty much insuring a lot of people in this country. Why this big debate on health insurance?
People don't need to lose their houses, go broke, or decide that they have to pay what is a high premium in order for them to get the medical attention that they need, but then lose their houses at the same time. So although it sounds good, you're looking at people who perhaps have to make really big decisions about whether or not they have health care or whether or not they can actually pay their bills and whether or not they can maintain some sustainable living.
John, I said at the opening of this, the Republicans and the Congress have been unable to repeal Obamacare, but it appears that what they're trying to do is kill it by 1,000 cuts. Do you agree with that assessment?
No, because I think what they're trying to do is modify it. The idea that it's just going to disappear is not something most of them really have in mind anymore. What they have in mind is that the
But they did to start off with, did they not?
Originally, they wanted to go in a fundamentally different direction, and the longer it took for them to try to, first of all, get the power, the electoral power to do anything about it, years went by. At this point, you've got lots and lots of people in federally funded exchanges. They're unlikely to disappear, but they might change significantly what they are, and they might become more like high-risk pools, which a lot of the Republicans wanted to do in the first place.
Well, no, I was going to say, first of all, that the Republicans ran on a platform of repealing Obamacare.
And replace it.
And replace it, and they failed. And they control the federal government. They control the presidency and the House and the Senate, and they didn't do it. I'm glad they didn't do it, but I think it's a little, it's probably not entirely correct to think, oh, they've just shifted their approach. They still want to repeal it, and they can't they can't do it with votes because they can't stand the pressure of their constituents. So they are, I agree with you that they are doing death by 1,000 cuts.
Well, North Carolina has one of the highest enrollments in Obamacare, the Affordable Care Act, of any state in the country. Why is that, Chris?
Well, because there are a lot of people in North Carolina that are signing up for what used to be relatively affordable insurance that didn't have insurance before. And then I think it's probably also worth noting there are a lot of studies that show Medicaid has reduced the number of Medicaid expansion of uninsured people. And here's what I've said on this program before. When it comes to Medicaid expansion, I stand firmly with Mike Pence, who expanded Medicaid when he was governor of Indiana, and there are plenty of Republican governors now who are among the bigger defenders.
And we're going to talk about that Indiana plan.
And by the way, the other reason why we have a somewhat higher enrollment rate than other states is because we did not expand Medicaid.
Yes.
So the point is, if you expand Medicaid, that's going to take it up to 136% of poverty, which means some people who are currently in the exchanges will then go over into Medicaid.
But Rick, this kind of moves
But yes,
us.
most people who get Medicaid expansion would not have previously been eligible.
This kind of moves us into last week, this past week's news, in which in order to get people signed up, and of course there was a mandate, people had to have insurance, but in order to get people signed up, the Affordable Care Act employed navigators. Now, CMS, the Center for Medicaid and Medicare Services in Washington, says we don't need those navigators anymore.
Well, what they've done is they found out something that didn't happen the first few years of the program. They've actually looked to see what the navigators did, how much service they provided for the money, and they found out they were a pretty bad deal. They were spending $63 million 2 years ago and enrolling something in the neighborhood of about 1% of the people who signed up for the programs. Last year, they had cut those payments to $36 million, and they're still enrolling about 1%. They find out most people get their insurance on the exchanges either through an insurance broker who can do it for about $2 a year, or they're getting it on their own by going to the website. Now, there's some question about how much people would go to a navigator and get some advice and then make their own choice, but there was very little oversight of that program.
Aisha, one of the questions I wanted to ask you, because you're part of the generation known as millennials, for some reason or another, even though there was a mandate for people to sign up, had to have health care insurance, either private or through Obamacare, whatever it happened to be, the millennial generation didn't sign up in very large numbers. Why was that?
Well, I'm a Zennial, but I'm a part of a micro generation, and we're really very special, so I want to clarify that. But that being said...
Was this because of being a millennial, or was this... Never mind, go ahead.
We can cover that another time. But what I'll say is that I think it's a challenge, because when you look at a lot of millennials, you're looking at people who have sometimes 2 or 3 jobs. They don't necessarily, I talked to a friend of mine who's 26 and will be off of their parents' insurance, and they really still can't afford it. So, I think that requires navigators. I think that it requires people who can help walk through the process. And I also think that it requires for millennials not to be underemployed, but to actually be adequately employed. So it's a challenge to navigate all of that coming into this current economy.
Thanks for bringing me back into the subject, which is the navigators. CMS said that they're only giving us $500,000 this coming year, which most of the companies that are providing these navigation services are saying, hey, that's just not worth it, we're not going to do it, because of the number of uninsured we have in the state. They seem to think that our uninsured rate is relatively low. They say it's just a million people who are uninsured.
Yeah, just 1 million people. So we have, what, roughly 10 million people in North Carolina. So just 10% of our people, as Aisha mentioned, are worried that if they get sick, they'll be bankrupt. And I do disagree a little bit with the study about navigators, or and Rick made a point, I think, at the end of his comments about that. I actually know people who have been navigators in North Carolina, and they spend a ton of time helping people and giving them advice, and then those people sign up on their own. The idea is, if we have a program that the taxpayers are paying for, that in my mind has served us well, why would we not want people to take advantage of it and use it and be insured and help us all as a healthier society? That's what the whole idea of this was.
Let me flip this just a little bit, John. So getting to the Medicaid issue, why did the state of Virginia, controlled by Republicans, why did they flip and decide that they were going to expand Medicaid?
The states that have done that, Virginia being the most recent one, it's important to keep in mind that Medicaid is a program that pays rich people. Now, the beneficiaries of the services are not wealthy, but Medicaid is a payment system for hospitals, doctors, pharmaceutical companies. They will lobby for this
we're going to get mail over that.
Every single year, over and over and over, until they get Medicaid expansion. And they will pick off Republicans until they get to the number. So the Republicans better understand that the lobby for Medicaid expansion is significant, it is well-financed, it will be there every single year. And if they want an alternative, which I think is a good way to think about it, they need to get that alternative designed and enacted. Saying no and having no alternative is not in the long run a sustainable position.
So, in other words, from your vantage point, saying no isn't a viable position. Expanding Medicaid is not a viable position.
I want to go after the actual cost of delivering the care, not just who pays the bill.
Well, isn't that what we're getting ready to do, Rick, with this managed care with Medicaid in North Carolina?
I mean, that's one of the ideas. Yes, that's right, exactly.
It's supposed to reduce the cost.
And it should if it's operated properly. That's always, the devil is always in the details. And so the idea is that basically if you provide a set fee per patient to every person based on their age, their health status, I mean, you adjust that, of course. And then you say, okay, you have to make sure that this person stays healthy for this amount of money. You can't charge per service. You can't double up on tests. You can't do all these other sorts of things that tend to pad the bottom line for the providers but not necessarily help the patients.
Aisha, a lot of the reason why our legislature and Governor McCrory, when he was governor of the state, opposed the Medicaid expansion to start off with was this 90-10 match. There was some concern that the government was not going to be able financially to continue that 90-10 match on a long-term basis. Isn't this one of those situations, though, where once you extend the benefit to somebody, you just almost cannot take it back?
Absolutely. I mean, let's just be clear. There were a lot of people who wanted to repeal Obamacare until they realized that it was actually the Affordable Care Act and they were benefiting from it. So I think that once you extend the benefit, you figure out how to make it work and you adjust a budget. That's the reason that we have the General Assembly there, to figure out how to make it work on behalf of the people of North Carolina.
Well, is there any sense, I mean, Secretary Mandy Cohen from DHHS went over last year as the session was winding down, trying to talk them into, who was it talked about, the Mike Pence and the Indiana plan, trying to talk them into a similar program for North Carolina. It went nowhere.
Well, but it was introduced by Donnie Lambeth, a Republican, very prominent Republican legislator. So this wasn't, there was actually a Republican idea to expand Medicaid on the table.
He also was a former hospital official, too.
Right. But you know, I want to comment on it for a second, because John always says that, oh, it's just rich people wanting it. Well, you know, I think most people in North Carolina probably think their doctor ought to make a significant salary for whether he or she has gone to school and that the position they hold in society. Yes, some people that probably, I have problems with the healthcare industry overall, but to cast a blanket over saying, oh, it's rich people that want this. There are actually doctors that want people to have insurance and want to take care of them, and I think they should be fairly compensated.
But unfortunately, 3 out of 4 doctors right now, excuse me, 1 out of 4 doctors in North Carolina are not taking new Medicaid patients because they're not getting reimbursed.
Well, and let me say this.
That's about reimbursement rates.
As you know from watching this show, we do a lot of work for the family physicians in North Carolina. I've had an opportunity to study their income lines over the last couple of decades. It is flat to declining. So it's not a case where they're making huge amounts of money. Maybe.
I respect all of the providers in the healthcare system, many of whom are among the most affluent income
You're just trying to back away
in the United States. No, I just restated my point again. I appreciate Chris defending people earning what what they are worth in the marketplace. That's a new thing for Chris. Let's encourage that. But all I'm getting at is my message is to Republicans. Republicans think, well, Medicaid expansion is this thing where it will benefit mostly lower income people, and the political pressure for that is not very great. No, the political pressure for Medicaid expansion is very great. And if you sit around and wait year after year after year and don't have an alternative solution, I think the interest groups that want Medicaid to be expanded will eventually win.
Chris, the hospitals came forward. Governor Cooper has talked several times about the fact the hospitals have offered to pay the difference in expanding Medicaid costs.
And I think, absolutely. And I think they do stand to gain. And I think we all should want healthy hospitals in our communities, and we've lost some hospitals. The other point you made earlier on, you said the reason they didn't expand it was another reason. That one of the reasons they didn't expand it in North Carolina originally is because Barack Obama proposed it. They actually said that publicly several times. So part of this was ideological because it was an anti-Obama movement. Now he's gone, and we're still debating it.
What they need to be following is the idea, as was mentioned, of some of these other plans like in Indiana where there were work requirements. Well, I think where the Republicans in North Carolina would like to see is the ability to expand Medicaid to some extent, but not all the way up to 138%.
Aisha, in Indiana, they had to make a contribution. Each individual had to make a contribution to a health savings account that was on this expanded Medicaid. What do you think of that?
I think that is a viable solution. I'm going to go back to something that no one wants to talk about probably ever again, and that is that if we want to actually address the system and the cost, perhaps we should have gone with a public option when it was actually put out there a long time ago. But since we didn't do that, we keep going back to try to fix something that we never tried to resolve in the first place.
Option. That's what
the public
Medicaid
option
is.
on the exchanges.
Exactly.
I understand. Headed towards government control. Well, I'm just saying, public option is quite literally Medicaid.
If that communist Mitt Romney had not come up with this plan, we wouldn't be sitting here today.
Absolutely right.
Wow, have we found something everybody can agree on?
That Mitt Romney's a communist? Gosh. Well,
we've been talking about our legislature. Their budget required the Department of Public Instruction to cut administrative funding by 6.2% or $5 million this year. June 29th will be remembered as Black Friday at the Department of Public Instruction. Superintendent Mark Johnson fired 40 employees and eliminated 21 vacant positions. Aisha, the cuts were made in two particular divisions within DPI: Educator Support Services, which helps low-performing schools, and Information Technology. Superintendent Johnson had asked lawmakers to delay those cuts, but they refused to do so. Did he make the right decision so far as what to cut?
No, absolutely not. I don't think that anything should have been cut. I actually reject the whole premise.
Well, he didn't have any choice. The lawmakers said he had to cut.
I understand that, but I think that the unfortunate part is that he had to make the cuts in the first place. So once you're backed into a corner, I don't think that you can make the best decisions, and I don't think that cutting technology when the United States actually is not necessarily on the forefront of our students being able to compete on a global scale, that makes a lot of sense.
He's going to outsource a lot of this technology stuff. What's our track record with that?
Well,
Chris?
It's been mixed, but I think one of the real stories here is, first of all, Superintendent Johnson was right to ask that these cuts not be made. Number two, there was an audit done that didn't say we needed to make these cuts. In fact, it said we needed to find more resources to help struggling schools, which is where I think we laid off 28 people whose job that is. So this was a little bit perplexing. The General Assembly is going to make these cuts no matter what. They tried to have an audit that would encourage them to it. That didn't work. Now they have the Republican superintendent say don't do it. That didn't work. The leadership of the General Assembly is bound and determined to keep cutting DPI no matter what other people say.
And this was a case where the State Board of Education and the Superintendent of Public Instruction agreed on something for a change, but that's not been their recent history lately.
No, it hasn't been. And I think some of what the superintendent may have done was the old Washington Monument strategy. You know, when the federal government closes down, you close down the parts of the government people really like to use a lot. And I think Superintendent Johnson may well have taken away jobs from positions in areas that really need the help to sort of stick it back to the General Assembly and say, hey, restore this money, or the schools that would need to be helped are not going to be helped. I think that was part of what was going on there.
Interesting theory. I had not heard that advanced before. All right, this goes back, John, to 2016, the December special session. The legislature took away part of the powers of the State Board of Education and assigned them to the superintendent. They went to court. The Supreme Court ruled. Both sides claimed victory in that verdict. How could they possibly both be right?
They can't. And in fact, the State Board of Education lost the case unanimously, and the state superintendent won the case unanimously. The end. Now,
our friend Bob Orr differs with you.
I understand that, but the state board can't keep insisting. For example, they have the right to choose who to hire and fire. That the superintendent, under the day-to-day administration language in the decision, clearly has some ability to hire people. And the state board needs to sort of comply with the Supreme Court decision, understand their job is policymaking, which they do have constitutional authority to do. And this superintendent has a day-to-day administration authority, which the Supreme Court has ruled he has the authority to do. In my opinion, this is an unwillingness to accept the decision.
But in this past session that just adjourned, Chris, HB 374 was a bill in which the legislature took another step forward and gave more control to the superintendent. Now, State Board of Education Chair Bill Kobe says this law is unconstitutional. Are we getting ready to go through another round of lawsuits?
Well, it sort of sounds like it. And for folks who haven't thought about it lately, remember State Board of Education Chairman Bill Kobe is a former chair of the state Republican Party. This is not a Democratic versus Republican issue, but I disagree with John. I don't think people in the General Assembly, or I don't know if the superintendent really accepts yet that the State Board of Education can make education policy and that he has to follow it. But all that being said, the irony, going back to your very first question, is with all these fights, the superintendent and the state board both asked the General Assembly not to do something that would hurt public schools, and the General Assembly did it anyway.
Yeah, Aisha, it looks like from the outside that what we really have here is a problem in that we've got a Democratic governor, we've got a Republican-controlled legislature. These people are worried about the fact that Governor Cooper is going to have appointive powers to the State Board of Education, and they don't want that. Is this just a partisan political fight? Is this what's going on here?
I think that it is. I mean, you know, they keep attacking, if you will, the governor and trying to take away his appointing powers from appointment powers since the time he came in the door, and then they continue to do it, and then they have now made it a constitutional amendment. So anytime they get a chance, they try to go after the Democratic governor.
Can I jump in for a second? We also, it's probably worth reminding the viewers, for the relatively rarely the General Assembly rejects governor's appointments to the State Board of Education. The General Assembly rejected two, both of whom were eminently qualified, just sort of as to put another sort of mix into this.
Yeah, we talked about that last week.
Right, and I thought that was ridiculous.
And they took an extremely long time to approve his other appointees.
But yes, that's true, because he made the appointments in March of 17. It was just recently. But Rick, this feud between the superintendent and the governor and the legislature and the state board has been going on for some time. If you remember, Governor Perdue went through all of this. Right. She went to court over all of it. The court then sort of ruled that the State Board of Education had the authority to be able to make a lot of these decisions. A lot of people are asking, the legislature didn't have any problem putting 6 constitutional amendments on the ballot. Why didn't they put another one on there, which really clarified who is in charge of governing public schools in North Carolina? I think
it's overdue, and they chose not to do it. They may rue the day they didn't do it, because they're pretty soon going to have a Democratic appointed State Board of Education.
Well, assuming that they approve it.
They approve any of the nominees. Right. You know what I think is, I think that maybe some of the Republicans might have thought about a clarification amendment, but they only put things on the ballot they were pretty confident would pass. And honestly, no matter what we think about the merits of the case, taking away the power of an elected superintendent or clarifying that some appointed board has more power probably wouldn't pass.
Well, so how would you fix this?
It has.
Well, so how would you fix this? Because we do clearly have a statewide elected position, the Superintendent of Public Instruction, and a State Board of Education, which has constitutional authority.
Personally, I'm in favor of the governor having more authority here, being able to appoint a board who hires a superintendent. That is the model I think makes more sense. I just don't think most North Carolinians agree with me.
Yeah. Well, speaking of most North Carolinians, they are eager to find out what you have to say this week that we don't know. Chris Fitzsimon, tell us something we don't know.
Well, I was thinking as I was we were about to start talking this in the show. In 2010, I had a conversation about this time with a Democratic member of the General Assembly who said, "Oh, we're fine. This big wave you're hearing about, not much is going to happen," and you saw what happened. I was really interested to notice that the Civitas poll has a generic ballot for the General Assembly. The Democrats have an 8-point percentage. The national congressional poll, the Democrats have an 8% advantage. There's a new poll that showed the Democrats winning in the 9th district. I think we can talk all we want about it. It might not be as big a wave, but that's what they said in 2010.
Well, and they've outraised the Republicans. Rick Henderson, tell us something we don't know.
The turmoil between the head of the UNC system, Margaret Spellings, and the Board of Governors is getting worse and will get worser. And it's
this is an editor using the word term worse.
That's right. Yes.
Okay, all right.
It's not going to get any better. There was a very ugly meeting yesterday, which we covered. Nobody else did, but which we covered, in which you could hear shouting behind the doors of a closed session.
All right, Aisha, tell us something we don't know.
Well, the North Carolina Democratic Party is ready for the blue wave, tsunami, undercurrent, and all of those other things. Last year in 2017, we actually turned 22 municipalities from red to blue, and that took place in smaller areas. So that means that we're ready for this year.
John Hood, tell us something we don't know.
Chase Treasurer Dale Folwell has announced that the employee premiums for the state health plan will be frozen this year, saving $38 million for state employees and their dependents.
Oh, good. Well, didn't know
you
that.
You may not
I didn't
have
say
known
good from the standpoint I necessarily agree with it. Well, you've heard our spin on the issues of the day. To stay informed all during the week, give your feedback and read my weekly column. Catch NC Spin on Facebook or NC Spin on the web. And join us next week for Balanced Debate for the Old North State. Until then, stay informed and watch out for the spin.
In rural North Carolina, vibrant main streets depend on a thriving agricultural economy. Research at NC State improves the products our farmers raise and grow. NC State Extension brings that research from labs to fields in all 100 counties, which means growth for rural North Carolina. At NC State, what we think and do helps grow local economies. Discover how NC State and Extension work for you. Visit wegrownc.ncsu.edu.
Production underwriting support provided in part by the more than 65,000 members of the North Carolina Retired Governmental Employees Association.
Today's tools make you a real DIYer, and as a member of an electric cooperative, you have lots of valuable tools to help you do it yourself in controlling your home energy use and budget, leaving you free to be Dad.
North Carolina Channel is made possible by the financial contributions of viewers like you who support the UNC TV network.